Hi all, welcome to my channel. Let's see some of the important Viva questions asked in PSM Practical. Postnatal case. What are the objectives of postnatal care? The objective of postnatal care are to prevent complications of the postnatal period, to provide care for the rapid restoration of the mother to optimum health, to check adequacy of breastfeeding, to provide family planning services, to provide basic health education to mother family. What are the complications of postpartum period? Complications of postpartum period includes puerperal sepsis, thrombophlebitis, secondary hemorrhage, urinary tract infection. Number of postnatal visits should a PN women have? Once a month for first 6 months. Once in 2 or 3 months till the end of 1 year. A minimum of 3 to 6 postnatal visits should be given. What are the signs of puerperal sepsis? The sign of puerperal sepsis includes rise in body temperature, increased pulse rate, foul-smelling lochia, pain and tenderness in lower abdomen. What is rooming in? Keeping the baby's crib by the side of the mother's bed is called rooming in. It gives an opportunity for the mother to know her baby. It allays the fear in mother's mind and also builds up self-confidence. How will you identify infants at risk? The basic criteria for identifying infants at risk are birth weight less than 2.5 kilograms, twins, birth order 5 and more, artificial feeding, weight below 70% of the expected weight, second and third degree malnutrition, failure to gain weight during 3 successive months, children with PEM or diarrhea, working mother, one parent due to less care and attention. Define preterm, term, and post-term. Preterm. Babies born before the end of 37 weeks gestation. Extreme preterm, less than 28 weeks. Very preterm, 28 to less than 32 weeks. Moderate to late preterm, minus 32 to 37 weeks term. Babies born from 37 completed weeks to less than 42 completed weeks of gestation. Postterm. Babies born at 42 completed weeks or any time thereafter of gestation. What are the common disorders screened in neonatal period? The most common disorders screened during in neonatal periods includes phenylketonuria, neonatal hypothyroidism, Coombs test, sickle cell anemia or other hemoglobinopathies, congenital dislocation of hip. What do you mean by weaning? Weaning is a gradual process starting around the age of 6 months, because the mother's milk alone is not sufficient to sustain growth beyond 6 months. It should be supplemented by suitable food rich in protein and other nutrients. These are called supplementary foods. Supplementary foods: cow's milk, fruit juice, soft cooked rice, suji, dal and vegetable. What are the components of kangaroo mother care? Kangaroo mother care is the care given to low birth weight babies to prevent high infection and mortality rate among the newborn. The 4 components of KMC care are skin-to-skin positioning, breastfeeding, ambulatory care, support the mother and her family in caring for the baby. What is BFHI? BFHI or Baby Friendly Hospital Initiative is created and promoted by WHO and UNICEF. It has proved highly successful in encouraging proper infant feeding practices starting at birth. It includes International Code of Marketing of Breast Milk Substitutes, written infant feeding policy, monitoring and data management system, ensure staff have sufficient knowledge, competence and skills to support breastfeeding, facilitate immediate and uninterrupted skin-to-skin contact and support mother. Discuss the importance and management of breastfeeding with pregnant women and their family. Support mothers to initiate and maintain breastfeeding and manage common difficulties. Do not provide breastfed newborns any food or fluids other than breast milk unless medically indicated. Practice rooming in 24 hours a day. Support mothers to recognize and respond to their infants' cues for feeding. Counsel mothers on the use and risk of feeding bottles, teats and pacifiers. Coordinate discharge. What are the leading cause of death in low birth weight babies? The leading cause of death in low birth weight babies are atelectasis, malformation, pulmonary hemorrhage, intracranial bleeding, secondary to anoxia or birth trauma, pneumonia and other infections. What are the advantages of breastfeeding? Advantages of breast milk are the following. It is safe, clean, hygienic, cheap and available to the infant at correct temperature. It fully meets the nutritional requirements of the infant in the first few months of life. It contains antimicrobial factors such as macrophages, lymphocytes, secretory IgA, antistreptococcal factors, enzymes and lactoferrin. It is easily digested and utilized by both normal and premature babies. It promotes bonding between the mother and infant. Sucking is good for the baby. It helps in the development of jaws and teeth. It protects babies from the tendency to obesity. It prevents malnutrition and reduces infant mortality. It provides several biochemical advantages such as prevention of neonatal hypocalcemia and hypomagnesemia. It helps parents to space their children by prolonging the period of infertility. Special fatty acids in breast milk lead to increased intelligence quotients. What are the maternal advantages of breastfeeding? Early initiation of breastfeeding is an advantage to mothers as it lowers mother's risk of postpartum hemorrhage and anemia, boosts mother's immune system, delays next pregnancy, Reduces the insulin of diabetic mothers. Protects mothers from ovarian and breast cancers and osteoporosis. What is Apgar score? Apgar score is an immediate estimate of the physical condition of the baby. It requires immediate and careful observation of the heart rate, respiration, muscle tone, reflex response and color of the infant. Each sign is given a score of 0, 1, or 2. Apgar score. 0 to 3 severely depressed. 4 to 6 moderately depressed. 7 to 10 normal. A score below 5 needs prompt action. Thank you for watching. Subscribe to my channel to learn